Hello everyone and welcome. My name is Dr. Omar Chaudhry and I'm a physician from Nairobi, Kenya with a strong passion for diabetes care. Over the years, I've had the privilege of treating many people living with diabetes, and those I've cared for know how committed I am to helping them understand their condition and protect their long-term health. Today, I want to talk to you about one of the most serious but preventable complications of diabetes: how diabetes affects the kidneys, a condition known as diabetic nephropathy. In today's digital world, social media allows anyone to share medical advice. While some of this information is helpful, much of it is unfortunately inaccurate, misleading, or even dangerous. In diabetes care, misinformation can delay evidence-based treatment and result in permanent harm. The purpose of this video is to share clear, reliable, and evidence-based information grounded in current medical guidelines that viewers can trust. This video is intended for people living with diabetes, their families, and anyone wanting to understand how to protect kidney health. So let's start with a simple question. What do the kidneys actually do? The kidneys are two small but powerful organs that work around the clock to filter waste products and excess fluid from your blood. They help regulate your blood pressure, keep your body's salt and water balanced, support healthy bones, and even help your body make red blood cells. Inside each kidney are millions of tiny, delicate filters called glomeruli. These filters clean your blood, but they are very sensitive to damage via various mechanisms, but to a large extent, persistently elevated blood sugar over time can injure them. So let's dive into the science bit of things. What exactly is diabetic nephropathy? There are multiple causes of kidney disease, but today's focus is diabetic nephropathy, kidney damage that develops as a direct consequence of long-standing diabetes. When blood sugar remains elevated over many years, it damages the small blood vessels in the kidneys through complex pathological pathways, including inflammation and scarring. High blood pressure, which commonly coexists with diabetes, adds further stress to these fragile structures and accelerates damage. Importantly, this process does not happen overnight. It develops slowly and silently over 5 to 15 years. In the early stages, most people feel entirely well, and many routine tests may still appear normal. There is no pain and no obvious warning signs, which is why diabetic nephropathy can progress unnoticed. If left unchecked, this condition can progress to chronic kidney disease, kidney failure, and eventually the need for dialysis or kidney transplantation. Dialysis is a life-sustaining treatment used when the kidneys can no longer adequately filter waste and fluid from the body. While dialysis saves lives, it significantly impacts the quality of life and requires major lifestyle adjustments. This reality highlights why prevention and early intervention are far more preferable to late-stage treatment. The most important message of today's video is this: most diabetic kidney disease is preventable if we detect it early and manage it appropriately. Now, who is at risk? Anyone with diabetes is. Both type 1s and type 2s can develop kidney disease. However, the risk is far higher if you've had diabetes for many years, if your blood sugar levels have often been high, if you also have high blood pressure, if you smoke, or if kidney disease runs in your family. This is why international guidelines, including those from the American Diabetes Association and Kidney Disease Improving Global Outcomes, KDIGO, emphasize regular kidney screening for all people living with diabetes. The longer you live with diabetes, the more important kidney screening becomes. Let's now talk about how kidney damage is detected, because this is absolutely critical and should be performed regularly by your GP or physician. You do not need to have any symptoms of kidney disease. That's why doctors rely on simple medical tests, not on how you feel. The first is a simple urine test that looks for a protein called albumin. Healthy kidneys do not allow albumin to leak into urine. Even a small amount can be an early warning sign of kidney damage. The second is a simple blood test that measures creatinine and calculates something called the estimated glomerular filtration rate, or eGFR. This tells us how well your kidneys are filtering your blood. If you live with diabetes, these tests should be done at least once a year, even if you feel perfectly fine, and more frequently if abnormalities are detected. So you might be wondering, what symptoms does diabetic nephropathy cause? In the early stages, there are typically no symptoms at all, which is why routine testing is essential. As kidney disease becomes more advanced, people may notice swelling in the feet, ankles, hands, or around the eyes. There may be foamy or bubbly urine, fatigue, poor appetite, difficulty concentrating, or shortness of breath on effort, and at advanced stages, even at rest. Unfortunately, by the time these symptoms appear, significant kidney damage has usually already occurred. Now, let's move to the most important part of this video. How can you protect your kidneys, and how can kidney damage be prevented or slowed? The first and most powerful step is simply good blood sugar control. Keeping your blood sugar as close to target range as possible greatly reduces the risk of kidney damage. Evidence consistently shows that even modest improvements in your HbA1c make a meaningful difference over time. The second key factor is blood pressure control. High blood pressure is one of the strongest drivers of kidney damage. Current guidelines recommend targets of below 130 systolic over 80 diastolic for many people with diabetes. Medications called ACE inhibitors and ARBs are commonly used because they not only lower blood pressure but also directly protect the kidneys. The third step is taking your prescribed medications consistently. Kidney protection depends on long-term treatment. Skipping medications because you feel well can quietly allow damage to progress. The fourth step is avoiding smoking. Smoking has shown to be significantly accelerating kidney damage and increases the risk of heart disease and stroke in people with diabetes. A majority of patients with advanced kidney disease have concurrent cardiovascular disease, making this risk particularly important. The fifth and very important step is healthy, balanced nutrition. This does not mean extreme dieting. It means reduced excess salt, avoiding unregulated high-protein fat diets unless advised by your doctor, and also focusing on balanced, nutritious meals, keeping a close eye on maintaining particular electrolytes in balance, such as potassium and phosphate. Dietary advice should always be individualized and guided by your healthcare professionals. Regular physical activity is also strongly encouraged. Moderate exercise, such as walking, cycling, or swimming, helps improve blood sugar control, lowers blood pressure, supports cardiovascular health, and contributes to overall well-being. Exercise does not need to be intense to be beneficial, but it should be consistent and safe for the individual. And finally, there are newer diabetic treatments that have transformed kidney care. Certain medications such as SGLT2 inhibitors have been shown in large clinical trials to not only lower blood sugar, but also to slow the progression of diabetic kidney disease, reduce the risk of kidney failure, and also protect the heart. Other newer therapies may also play a role depending on individual risk profiles. These treatments are now strongly recommended in international guidelines for appropriate patients and should be discussed with your healthcare provider. Now, the favorite part of my talk. Let's briefly address some of the common myths frequently seen on social media and often discussed in my clinical practice. One myth is that only people with very high blood sugar develop kidney disease. This is false. In reality, even moderately elevated blood sugar over long periods can cause significant kidney damage. Another dangerous myth is that herbal cleanses or natural remedies can heal diabetic kidneys. There is no reliable scientific evidence to support this, and some products may actually worsen kidney function or interact with prescribed medications. Another common misconception is that if my urine looks normal, my kidneys must be fine. Remember, early kidney disease is often invisible. You cannot see it or feel it without proper testing. This reinforces why evidence-based medical advice is so important, particularly in the digital age. As we come towards the end of this video, I want to leave you with 3 key messages. Firstly, diabetic kidney disease is common, but it is largely preventable. Second, you can have kidney damage without feeling unwell at all. Third, good blood sugar control, good blood pressure control, regular screening and appropriate treatment protect kidney function and save lives. Finally, if you live with diabetes, I strongly encourage you to ask your healthcare provider these 3 simple questions. What are my latest kidney test results? What should my blood pressure target be? And are my current medications protecting my kidneys as well as my blood sugar? Thank you very much for watching. If you found this video helpful, please consider sharing it with others living with diabetes. Accurate medical information empowers patients, strengthens communities, and prevents long-term complications. Take care of your health, protect your kidneys, and I'll see you in the next video. As we say in Swahili, kwaheri.